Hello, everyone. Gender justice and reproductive rights have seen many strides forward as many strides back. I'm here with Pooja Gupta to help shed some light on this topic.
Hi, everyone. My name is Pooja. I'm a nurse working at labor and delivery in Northwell Health, and I'm here to help assist with this.
Okay, awesome. Have you ever witnessed a patient being turned away due to low socioeconomic status, their healthcare coverage, example like Medicare, HMO plans, or homelessness?
So we at the hospital actually follow something called EMTALA, and what it stands for is Emergency Medical Treatment and Active Labor Act. So basically, we provide emergency medical screening and examination and any necessary stabilization to all persons who present themselves for emergency care. And this is actually regardless of their ability to pay, regardless of their socioeconomic status, their race, gender, and any other discriminatory factor. Patients with emergency medical conditions are transferred to other facilities as well if for some reason we cannot provide them that care or if it's the patient's request. And if for any reason, the patient's medical needs cannot be met, then we basically make sure that they are transferred to another Northwell facility or honestly wherever they want to go. If we don't have capacity or capability, or even if it's the patient's request to do so. So, no, I actually have not witnessed ever a patient being turned away for any of their, status or healthcare coverage, Medicaid, HMO plans, or any other reason like that.
Okay. Does the hospital have any current policies in place to address patient or staff concerns about racism or sexism? And who's the contact person and what is the protocol?
So we actually do have policies in place to address those types of concerns. Northwell Health complies with applicable federal civil rights laws, and it does not discriminate on the basis of the individual's age, race, religion, color, national origin, or citizenship, or any other, sexual orientation. We also don't discriminate against military or vet status. So we also have a Center for Equity of Care, which is located right near, a lot of the Northwell hospitals. It's located at Lake Success, 1981 Marcus Ave. And this is for both patients and staff if they ever have any concerns regarding, any discrimination against race or sexism or any sort of that. You can send an email to them or you can even give them a phone call regarding any of these concerns.
What type of care are available at the hospital to foster reproductive justice? For example, if a woman has 6 or more children, is it common practice for the doctors to pressure the woman to have tubal ligation? If so, who can she consult?
I work alongside a lot of Northwell colleagues, and we tirelessly advocate for stronger reproductive justice. The Supreme Court overturning Roe versus Wade was a big topic of discussion for a very long time throughout healthcare all over, but especially on my unit because we are, labor and delivery, a women's health unit, and it was very upsetting and devastating, and we believe it's going to impact all of Americans. And, it was a very tough decision. However, we always advocate for stronger reproductive justice. And, we urge people to go to facilities that can provide them with the sources that they need. On my unit specifically, we work with high-risk pregnancies every single day. Almost every patient that we have on our unit is a high-risk patient and a high-risk pregnancy, and we specialize in that. But that does not mean we don't encourage women to reproduce. We actually strongly advocate for it. In terms of tubal ligation, it's not something that's advocated, and we don't push patients to do that, not in the hospital setting and not in the office setting either. sometimes if the pregnancy is dangerous to either the mother or the fetus, then contraception and, birth control, it is advised if it is dangerous for either party involved. And for example, if someone's had multiple C-sections and they just cannot, carry another pregnancy on, then that's when we recommend, birth control or other contraceptive measures. But I haven't really experienced too many cases where tubal ligation is something that's pushed. Even, I have a lot of other colleagues that work in offices behind the scene, and they themselves have also said tubal ligation is never advocated. It's always a patient's decision. And it's also something that you actually need to get minimum 30 days before your due date. So if someone decides last minute that they want a tubal ligation, if it's an elective, surgery or a procedure that they opt in for, we actually do not provide that just because we don't know if they're being influenced by hormones or emotions or other, outside factors. So there's actually a lot of thought that goes into a tubal ligation. So yeah.
Have you encountered sexism at the hospital?
So I don't deal with too much sexism. I work basically in a field where it is very women dominant. And we do have male attendings. However, nurse-wise, it's very female-dominant. So we don't deal with too much sexism. And in terms of patients as well, it's, we mostly deal with female patients that are giving birth. So sexism in both like patient care or even staff-wise, it's not too much of an issue for us. If anything, it's actually looked up to, when you're in a room full of female providers and nurses, doctors, nurse practitioners, anesthesia. It's actually something to be proud of on our unit that women have succeeded so much, and our patients, they're all females, and we just have so much pride and joy in serving these type of people.
So healthcare is always evolving. Is there any type of organizational changes you would like to see at the hospital, if any?
So, of course, there's always room for improvement in every specialty, every unit, every hospital. In my specific area of specialty for obstetrics and women's health, one thing I would like to see improve is how we deal with maternal mental health. Of course, we have social work, always there 24/7 around the clock for cases. However, I find that we can do a better job when patients leave our hospital after giving birth, when they get discharged. I find that we can provide them with more resources to help avoid things like postpartum depression. So postpartum depression, it has increased over time. And, there are more high-risk pregnancies now than there were before. And I believe that's just because of, how our lifestyle has changed over time. Also, the age of pregnancy has increased, whereas there was a greater percentage of pregnancies between, I think, ages of 19 and 24. And now that has decreased, and there's a greater rate of pregnancy between 25 and 45 now. And anything above the age of 35 is considered a geriatric pregnancy. So when you do have a geriatric pregnancy, there are more chances for high risk and, issues with the fetus and your baby and things like that can cause a lot of postpartum depression. And I find that 50% of postpartum depression goes untreated because we're unaware. And I think even the patients are unaware that they have postpartum depression. Many decades ago, people used to have kids and they used to be full-time moms, stay-at-home moms, housewives. They were not working outside of that life of theirs. So it was a lot easier to have kids at a younger age and be able to stay with them at home and raise them. And, life was a lot easier to maneuver. Now women working it's a phenomenon, but women work full time. Now they have kids. They're full-time moms. They're having kids a lot later in age. So postpartum depression is a serious thing, and I find that maybe we can provide more resources to help them out. So basically being aware that, hey, I do have postpartum depression. I should go get help. This is a serious issue. It's not just something that can be brushed off, because I also find that people don't think it's a serious issue. But postpartum depression it can last a very long time. It can have negative feelings towards your family, to your newborn. It can it can prevent you from reproducing again. And we don't want that either. So I feel like if we can provide like more help, outside of the hospital, and, maybe, some time to basically send them to nurseries, or just giving them a call, a couple days, couple weeks after they're discharged. I feel like that can really go, a long ways and really help out families that we aren't even know that they're struggling. So we do have FMLA, which stands for Family and Medical Leave Act, and it does provide basically 2 weeks of a nesting period before someone is to have birth, and then it provides 12 weeks off afterwards. However, a lot of the times this is unpaid, depending on how much PTO you have. So if there is someone who has not accumulated a lot of PTO, it doesn't really work in their benefit. And yes, your job is protected. However, here you are with a newborn, and a lot of these people are first-time moms. And it's a lot to deal with, having an unpaid job, and, having your job protected just sometimes is, you need more than that. It's not enough. I find that other countries, they do provide better care in terms of their leave acts for pregnancy or any other, reason that someone might have to take a leave from work. There are more paternal time off as well, so the fathers can be more involved and help out as well. Longer periods. I find that some countries have 6 months of time off, and it is paid. So I think we can definitely do a better job throughout the country with the FMLA Act and how the pay goes for that. Not just, your job security, but more pay with your time off. So we aren't too stressed out. When we have kids and we have to take some time off of work, I feel like a combination of everything can create a healthier environment and less stress on these families in the time that we live in, where, there's so much increase in prices for everything, for daily lifestyle has gotten so much more expensive than it has been before. And, going 12 weeks without getting paid, it's very critical to that.
So what resources are currently available at the hospital for those who are hospitalized with no income?
We have a financial assistance program. And through this program, we provide discounted services based on financial need, of course, to people who are uninsured or underinsured, ineligible for government programs or other third-party coverage, people that don't have income, and they're unable to pay for emergency or other medically necessary services. This program can help with that, and you can apply to it. Of course, you need to provide documentation, and it is urged to apply to it, I think, within 90 days of your care, just to get it taken care of immediately. You can, there's a form online where you can apply. You can even apply by mail if that's easier for, a lot of the times I notice the senior citizens, they're not as tech savvy. So you can always, they still do paper mail. So they do, serve a broad age spectrum in that. And they do help out, any race, gender, socioeconomic status that needs it.
Do nurses ever perceive that they're being discriminated against by patients or the hospital staff based on their race, skin color, or religion? Has anyone been rude or made fun of nurses who have limited English or a foreign accent?
In terms of limited English and foreign accents, I haven't experienced too much discrimination towards that. I personally also, in general, with racism or, anything regarding color or religion, I haven't experienced it too often, but I have experienced it at least once or twice. I can recall a moment actually that we start our shifts at 7 o'clock, and it was like 7:15. I walked into my patient's room, and I was very pleasant with her, as I am with all of my patients. Very pleasant with her. She didn't really give me a chance to get to know me. I think I only was able to, check her ID band, and I think that's as limited as our conversation was. I checked her ID band, and I kind of left the room, and she immediately called a manager inside, and, she requested a different nurse. And I was very confused to why that happens, because, as I mentioned, our encounter was probably actually 2 minutes where I introduced myself. I checked her ID band and like a general, introduction. And that's about it. I feel like I wasn't really given much of a chance. And I don't know that this was, anything because of discrimination. However, I do suspect it may have been. And some of my colleagues that were near me also suspected that. So as much as I don't really deal with it on a daily basis, I have in the past. And I do think there are some nurses, and not even nurses, some doctors and other providers that still deal with those. As much as racism and discrimination has changed, and we always tried to avoid these type of things, they still do exist in the system, not only with patients, staff, with family members. I think it's something that we can do a better job and, not go into a situation with any type of bias. And this is for both patient and staff. In terms of staff-wise to patients, I personally don't see it too much on my unit. I don't see it at all, actually. I'll be honest. My unit is pretty cultured, and we have a lot of staff from many different countries and race, and they do have accents, and their skin colors are different, hair colors, everything is different, and we kind of work as a family, and we all accept each other for who we are, and we treat our patients the same way. So I don't see too much of that from staff to patients. However, I might see it more the other way, where patients feel that way towards the staff.
What is the hospital protocol for rape victims, and how and when is law enforcement notified?
So we have something called the SANE program, which stands for Sexual Assault Nurse Examiner. And they're located in the emergency departments of a few Northwell facilities. In the emergency department, they're in a completely separate area, and it's specifically designed for interviewing and examining, treating, counseling, and comforting any victims of rape or sexual assault. The center consists of a private entrance as well. And there's a private sitting room, examination room, bathroom. The bathroom includes a shower. And, together the physician and the SANE nurse, and the SANE nurse is trained to examine a patient of sexual assault. They can provide medical assistance, emotional support, and other information. They also physically examine the victims to collect forensic evidence that can be used in the prosecution of the offender. So in terms of the evidence, now it's obviously the patient's discretion whether they want to use it or not. However, the forensic file is always made, and it's locked away and sealed away. And in terms of notifying law enforcement, that's also the patient's discretion. If the patient doesn't want to involve law enforcement, that's their right. However, if they do, then, the police is involved in the patient's care and follow-up. And it's a collaborative effort. So in terms of the Northville facilities that I'm talking about, they collab with Special Victims Squad of the Nassau County Police Department, as well as the Nassau County Coalition Against Domestic Violence, which is the NCCADV. And also Sex Offense and Domestic Violence Bureau of the Nassau County District Attorney's Office. So, there's a large party involved if you want to get the law enforcement included into this. So, with all these different team members of different specialties, we try to provide the best care possible that we can to any rape victim that comes in. And we do it as privately as possible. And all with the patient's permission and discretion.
Nursing is a tough profession. How do you avoid burnout or compassion fatigue after interacting with patients all day? And what are some tips that you have for others starting out in the healthcare field?
Starting out in the healthcare field, it's definitely very difficult, and it could be very challenging and intimidating. Nursing is a profession that you can have a nurse who's 22 years old, you can have a nurse who's 40 years old, you can have a nurse who's 65 years old. And, this age range, every nurse has different methods of practice, and the way they teach can be different. So, for new nurses starting out, I definitely recommend them to try to do a specialty that they really enjoy and they really love. Definitely the first year of nursing, a lot of the times people need to do the basic med-surg unit, medical surgical, which is kind of an overall generic unit. And that's basically to help with your fundamental skills. But after the first couple years, I do urge new nurses to explore the realm of nursing because it is very broad. There are so many units and specialties and facilities. You don't have to work in a hospital setting. You can work in outpatient, inpatient, offices, clinics, infusion centers. So I think definitely exploring all options and finding an area that you love and enjoy and truly have a passion for is very important. I love the unit that I work in, labor and delivery, and I genuinely get very happy going to work. I'm probably one of the few that actually feel that way sometimes because my unit is a crazy high-risk unit, but no matter how difficult it does get, because I genuinely love my specialty, I find that it really goes a long way in your overall mental health and how happy you are in general. If you're happy at your job, you're happy when you leave your job, you're happy when you're going to your job, you're happy on your days off, it really makes a difference. In terms of burnout, now, no matter how much you love your job, you will encounter burnout. It happens to the best of us. Some ways to avoid that and to maintain your mental health is honestly self-care. You should use your PTO. You have it. It's a benefit that we have as healthcare workers. And in any profession, actually, not just nursing, but any profession, you have your paid time off. Even if you don't have a vacation, I think it's very important to take that paid time off for days to just be at home, sleep in a little bit, self-care, indulgent hobbies. Having hobbies on a constant basis is also very important. You need to take time out to do things you love outside of your job. A lot of people, they work full time, but they're also full-time mothers. They're also full-time fathers, full-time wives and husbands. And it's hard to juggle all of that. So sometimes taking some of it off of your plate, as simple as using some paid time off, can go a long way. Self-care, indulgent hobbies, take care of your health. Don't get too busy in life that your health is on the back burner. Make sure you also focus on that as well. So I find that there's many different ways that you can maneuver to make sure that every day you wake up and your mental health is great, your health is great. You're social enough outside of work and outside of your family life that you're able to maintain everything. And this is how you can avoid burnout.
Thank you so much, Pooja. I really appreciate you taking this time to shed some light on the topic.
Yes, of course. I'm so happy to be involved and be a part of, this topic. Reproductive rights definitely need to be addressed, and we can all do a better job in spreading that throughout the nation. And I really appreciate you taking my input, and I loved being a part of this. So thank you so much as well.
So thank you so much for meeting with me. Welcome. Good afternoon.
Good afternoon.
So I wanted to ask you just a few questions about, what you do in your field, so you can enlighten and educate us in the field. So can you tell me your name, where you work, describe what you do for work, and how many years you've been in the field?
Sure. So my name is Meredith Masiello. I'm a genetic counselor, and right now I work for Quest Diagnostics, the laboratory. And as a laboratory genetic counselor, what I do is I support our genetic test offerings, and my responsibilities have many facets. I act as a clinical liaison, specializing in women's health. So basically prenatal testing, carrier screening, reproductive testing. I answer questions that medical providers have regarding our genetic testing. I make sure that they order the correct testing for the problems that their patients have. I help explain results to the providers, normal and abnormal results. I help coordinate testing, especially prenatal testing. When we get prenatal samples in our laboratory, often the testing that's needed isn't all offered at my facility, so I coordinate sending it to other laboratories in the country. I also help our sales reps. I act as a scientific specialist, so I go out with them, now since COVID, we do a lot of virtual visits, and I help talk science to the medical providers that we're trying to sell our products to. I help with launches of new genetic tests. I also help with our literature, sales literature and literature for patients regarding genetic testing. And I also speak with patients to explain test results to patients who have had genetic testing performed at Quest. So that in a nutshell is what I do here. I've worked in the laboratory side as a genetic counselor for how many years? For 14 years. And before that, I worked clinically counseling patients in a maternal fetal medicine office, regarding prenatal genetic testing. And I worked in a children's hospital as well, working with families who had children with genetic disorders. And I did that for 15 years. So I guess that's my career.
Do you have experience in working with the LGBTQ population? Do they have access to reproductive technologies as the regular heterosexual couple?
I don't have a lot of experience working with them, but I know that they do have access to reproductive technology. Nobody discriminates against them these days. Okay. If they have the resources, yes. I mean, very often we'll get samples in our laboratory, prenatal samples from couples, and we're told that it's a woman, and it's it was an IVF, and with an egg donor, a sperm donor, her egg, and they're part of a lesbian couple, and a lot of times both members of the couple will get pregnant with sperm from the same donor, so technically that their offspring are half siblings because they have the same paternal genetic makeup.
Oh, okay. All right. That's great. Because we never want to, discriminate against gender and sex. And
no, absolutely not.
I feel like every state should be like New York in that way. Unfortunately,
New York is very liberal in many ways, which
which is great.